My job was to turn the mic on. Dory took the fire out of what I was going to say. I did want to just welcome the members of the Dolan committee here, the Dolan family, and I wanted just to take 5 minutes to remember Dr. Ryan, who was a great guy and very instrumental in starting this lecture. If we could have a quick minute of silence for him. Thank you. I'm going to introduce Dr. Willett, who will introduce tonight's speaker. Thank you.
Thank you, Mr. Dolan. Good evening. My name is Peter Willett. I'm a hospital-based internist here at VHC Health, and I oversee the Graduate Medical Education Committee. It is my great honor to introduce tonight's speaker. Dr. Joel Selanikio is a practicing physician, TED speaker, inventor, emergency responder, and consultant working in the fields of technology, healthcare, artificial intelligence, entrepreneurship, social innovation, big data, child health, and disaster response. He's the winner of both the Wall Street Journal Technology Innovation Award for healthcare and the $100,000 Lemelson MIT Award for sustainable innovation for the development of the Magpie mobile data collection system, the first cloud-based application created for global health and international development. Dr. Selanikio has consulted and/or spoken at Davos, the World Health Organization, UNICEF, Harvard, MIT, Stanford, Google, DARPA, CNN, Fox News, the Clinton Global Initiative, the Royal Society of Medicine, and for the pharmaceutical and healthcare industries, and has been profiled by The Guardian, Wired, Forbes, TED, The Economist, The Wall Street Journal, Fox News, BBC, NPR, Information Week, and The Washington Post, among many other publications. An emergency responder and former CDC epidemiologist and outbreak investigator, Dr. Selanikio served as a consultant epidemiologist to FEMA and the DC Department of Health for the COVID-19 response over 2020 to 2022. In December 2014 to January 2015, he was the lead physician at the IMC Ebola Treatment Center at Linsar, Sierra Leone. As an officer of the Public Health Service, Dr. Selanikio served as Chief of Operations for the HHS Secretary's Emergency Command Center after the 9/11 attacks. He has received awards from both his alma maters, Brown University Medical School and Haverford College, for his humanitarian work. As an accomplished pediatrician, senior CDC epidemiologist, and award-winning software developer, Dr. Selanikio is positioned at the interconnection between the worlds of technology and medicine. It is from this unique vantage point and perspective that he's going to speak to us today. And without further ado, Dr. Joel Selanikio.
Thanks for that very complete introduction. You've been speaking to my mom, I can tell. So first of all, thanks so much for inviting me here today. It's an honor to be able to give the Dolan lecture, and especially after such a long lull due to the COVID pandemic. I know this is an audience largely composed of healthcare professionals. I know everybody knows a lot about healthcare here, and especially about your own work, a lot more than I do, even though I'm a practicing physician myself. But the goal here tonight, for me, is not to talk to you about your daily work in healthcare or what happens in the hospital. My goal is to zoom out from those trees and give you a more expansive view of how I see the forest that healthcare is sitting in, that healthcare exists in, a view that I don't think you will have heard before, or that many of you will not have heard before. Disclosure, I will admit it, I am a fan of Apple. I was a fan of Steve Jobs. I guess I still am a fan of Steve Jobs. And I'll be talking about them both quite a lot during the course of the presentation, and I have a strong financial interest in the success of that company. Don't hate the player. This talk is going to be presented in 4 sections. In the first, I'll talk about the about basic disruption theory in business, something some of you I think will be familiar with, others will not. In What Did Steve Know? I'm going to talk about the 50-year trend toward the consumerization of information technology. In The Rise of DIY, I'll explain the effects of that consumerization on health and healthcare. And finally, in Where the Puck is Going, I'll talk about what we can expect in the next 10 to 20 years. So let's dive in. I like to start each chapter with a quotation, and I think this is a terrific one about the nature of disruptive innovation. Disruption, of course, is a common word, but it's also a term of art in business, and especially in the information technology business. And when I use it, I am not talking about the common use of the term as something that causes an interruption, like if the fire alarm went off right now. I'm talking about radical change to an existing industry or market due to technological innovation. And I'll give you a classic example, which is not healthcare, but I do promise I will bring it back to healthcare. So, steel making. Now, since the 1800s, steel was produced for quite a long time in integrated mills, as shown in this diagram of the Lackawanna steel plant. This is part of Bethlehem Steel, about 100 years ago. This was essentially centered around the process called the Bessemer process that had been invented about 50 years before that by a guy named Henry Bessemer. Very complicated process. And each plant would employ thousands and thousands of people doing all sorts of things. But in the 1960s, a new type of steel manufacture came into play. This was called the mini mill. And mini mills used a completely different process, which actually was older, but simply used electricity to create heat and heat to melt scrap metal into a molten form, which could then be reused. And this was actually invented, first demonstrated in 1810, long time ago, by Sir Humphrey Davy, who's pictured there. But it didn't really come into use until the mid-20th century because, frankly, back in 1810, there was not a lot of scrap steel lying around, right? Because we were just early in our industrial process. And so the process was not economically viable until about the 50s and 60s. In any case, the complex integrated mill was able to produce a very wide variety of steel products, ranging from rebar, that stuff that you see, those bars you see them putting into walls at construction sites to strengthen the walls, all the way up to really high quality surgical steel. And mini mills, or at least at first, could really only manufacture that rebar. They did have a single advantage though, the mini mills, which was that they could produce the rebar for 20% less. I mean, everything else about the mini mills was basically worse than the integrated mills. But let me show you what 20% less did to the American steel industry. Over 50 years, the mini mills ate the lunch of the integrated mills, causing most but not all of them to close over 50 years. And over that time, the mini mills got better. They took their profits, they reinvested into their process, and they managed to to learn how to make better types of steel. So they moved their way up the value chain. Not all the way up to surgical steel, but they managed to take a lot more of the business away from the integrated mills. And because the mini mills were so much simpler and employed so many fewer people, employment in steelmaking dropped over 50 years by 75%. That's all from 20% less. Now, I said that this is a classic example of this term of art, of disruption, and that's because it figured in the 1997 book, The Innovator's Dilemma, by former Harvard Business School professor Clayton Christensen. How many people have heard of this book? Okay, so quite a few. Not everybody, but quite a few. This is one of the most influential business books of the last 50 years, and in that book, Christensen coins the term disruptive innovation. And in it, he tried to figure out this puzzle to him of why you could have companies, or sometimes whole industries, which were at the top of their game. And those companies could see a new technology that threatened them. They could experience the threat for years or decades and somehow still fail to react. You know, over that 50-year period, how many integrated mills adopted the mini mill technology, for example, even just to make rebar? None. None. They lost all that revenue, they watched it happen, they did nothing. And he discovered this pattern. First, that the disruptor, in this case the mini mill, importantly doesn't have a better product. We often think that for you to take somebody else's business away, you have to have a better product, right? It's got to be better technology. In their case, they had a worse system. It was just better in one critical respect, and that respect was price. In every other respect, it was worse. And because the product seemed worse, you can imagine the integrated mills looking at those mini mills, and they said things like, let them take away that rebar business. We don't even have a high margin on that. We hardly make any money on rebar. Let them have that. It's just a hassle. Let's focus on our really high-end stuff like surgical steel, where we make our really big money. And they did that, but as I mentioned, the disruptor will take their profits, they will get better and better, and then they will take more and more business away from the incumbent businesses. Lots and lots of examples of this happening. The VW Bug, when it was first introduced in the United States back in 1949, was ridiculed because it was small and underpowered, but of course it was very cheap. And Volkswagen is now the largest car maker in the world. Netflix, which I should explain to the younger members of the audience, used to not be a streaming service, but was a service that, bear with me, sent you DVDs by mail. They actually just terminated that aspect of their service this year. So it's still been going on. I think my mom was subscribed to that still. People thought it was silly. They said, who wants to wait 3 days for postal mail to deliver a DVD when I can go into a Blockbuster and get my DVD right now? Netflix's single advantage, price. They didn't charge late fees. Right? Blockbuster, you could wind up, if you forgot about that darn DVD, you could wind up paying 20 bucks for a late fee. And one example, maybe a little bit closer to home. Now let's talk about an example where the same exact technology can both disrupt and also improve an existing system. And I'm talking here about the New York subway system. I'm originally from New York. When I'm there, I ride the subway pretty frequently. The way that you pay for a subway ride has changed substantially over the course of the last 100 years, as you'd expect. I'm not quite old enough to remember when paper tickets came out in 1904. But I do remember as a little boy, my dad used to have those metal subway tokens in an ashtray. He was a non-smoker, but when I was a kid, a lot of non-smokers had ashtrays in the house. He had those with his pocket change on top of his dresser. I was more of a MetroCard guy. MetroCard came out in 2003, and they're just only now phasing it out. And each of these new technologies improved the subway experience. They made it easier to ride the subway. The tokens were more durable than paper. The MetroCards were rechargeable, so you spent substantially less amount of time waiting in line, for example, to buy tokens. You just had to do it once in a while to recharge your MetroCard. But in 2020, another innovation was introduced. This is called Omni. Basically, it was introducing Apple Pay, right? Using your phone at the turnstile to pay for your trip. And Omni, of course, had substantial advantages because now you never had to wait in line in the subway. I can tell you as a subway rider, this is a dramatic improvement, right? You never, ever have to wait for 15 minutes in the middle of the rush hour in a crowded line. But the thing was, while this was being introduced, some other folks were using the same technology, the same smartphone technology, not to improve the subway experience, but to avoid it. Folks like Uber and Lyft. And I can't prove causality here, but subway ridership all over the United States started to decline around this time. And before Omni was introduced, back in 2019, still more subway-killing innovation was introduced, like all those shared bikes and scooters that are useful and drive us crazy and clutter up our sidewalks and cities. So again, the exact same technology in this case can both be sustaining, according to Christensen's terminology, where it improves existing products and helps existing companies, and also disruptive, where it enables new stuff to be built that actually diminishes or simply ends existing incumbent products or even industries. And this concept is going to come up a lot in my talk later, and I think plenty in your careers, and perhaps even more so in the careers of the folks I'll be giving this talk to tomorrow, which is the residents. What did Steve know? Raise your hand if you ever had a BlackBerry and you loved it. Yeah. For the young members of the crowd who might not know what a BlackBerry is, this is what people spent way too much time on before the iPhone came out. I love my BlackBerry, but there's not too much left of BlackBerry now in 2023, except for maybe my all-time favorite business quote. You can't make this stuff up. And to understand why the CEO of BlackBerry thought that they would just be fine after the iPhone introduction, we need to cast our memory back 16 years. It's not that long ago. It does seem like a lot longer to me. Back then, George W. Bush was the president. You got videos at a video store, as I mentioned before. Remember those standalone GPS devices that we had in our cars? And no one could figure out what Twitter was good for. Some of us are still puzzling through that. But back in 2007, BlackBerry was having an exceptionally good year. In fact, it was the best year in their history. They had record-breaking revenue. BlackBerry was the center of business mobile computing, which was the most exciting and dynamic and innovative and interesting part of information technology at the time. Now, there was a consumer mobile side. People had some basic, those little candy bar cell phones, those dumb phones. But it was smaller and it wasn't growing as fast and didn't get as much investment. So if you were a betting person, you would have bet that business mobile would continue to be where it was at in terms of information technology, and you would have been colossally, colossally wrong. Woe be to you had you invested in BlackBerry in 2007. Because after 2007, with the introduction of the iPhone, it was consumer mobile, not business mobile, that exploded with apps and brand new mobile users and revenue eventually completely overshadowing the business market to the extent that now businesses just either buy you an iPhone or buy you an Android phone or you ask to bring your own phone in and use it at work. But getting back to BlackBerry. Oh yeah, 2007 as a fantastic year for BlackBerry until a basically second-rate, second-tier computer company named Apple, who had never been in the phone business, tossed a match in the form of a keyboardless, that was a big deal, people laughed at that keyboardless, portable computer called the iPhone and ignited this consumer mobile revolution and became a nearly $400 billion in revenue company in the process. Subsequently disrupting the phone business, photography. You know, they used to sell cameras, right? The music industry, entertainment, travel, transport, banking. What about healthcare? Well, we'll see. By the way, there's a new film that's just came out within the last couple months. I see Maria's there. Have you seen this? It's actually hilarious. It's exactly about this. What happened at BlackBerry, the rise and the fall centered around the iPhone introduction, and it's quite good. Definitely recommended. Now, when he introduced the iPhone, Steve Jobs quoted the great hockey player Wayne Gretzky as saying, "I skate to where the puck is going to be, not where it has been." And this always intrigued me. I didn't see, back then you couldn't watch the Apple keynotes live unless you were actually there, but I did watch it later in recorded video. And I thought, did Steve Jobs really know where the puck was headed? And how did he know? And how come the folks at BlackBerry, who were basically in charge of mobile technology at that time, how come they didn't know? And to answer those questions, we've got to go back even further in time to look at about a century of computing. Now, this is a complicated slide with a lot of stuff on it, but one way to break this down and make it sort of make sense is to think, who is the customer? So for most of the 20th century, the customer for computing were institutions. And this was universities, corporations, governments, not people, right? Not consumers. Around about the 1970s, because of the success of the companies that were selling to those institutions, they made advances in miniaturization. And because as they sold more, the cost of components came down. And they began to develop devices that could actually be sold. They were cheap enough and small enough, they didn't take up a whole house, that they could be sold to small businesses. And then eventually they could be sold to families or even to individuals, right? The personal computer. Probably the best example of that would be the IBM PC, which was the computer of choice for businesses, but also the computer of choice for a lot of much smaller organizations or even individuals. And this has gone even further. So for about the past 20 years, starting with products like the unbelievably popular iPod, now the large majority of computing devices created in the world and the large majority of software created in the world is not created for institutions, it's created for individual consumers. It's designed for and takes into account the needs of consumers much, much more than it does the needs of institutions. And getting back to how Steve Jobs knew about this, we have to remember that Steve Jobs didn't just live through these changes. He was instrumental himself in this process of consumerization, right? This is a guy who helped to launch personal computing in the first place, the graphic interface, the iPod, which revolutionized the music industry, the iPhone, possibly the most popular or most lucrative product ever created, and then the Apple Watch before his untimely passing from pancreatic cancer. It might be that in 2007 when the iPhone came out, there was no other human being on earth who knew more about this long-term secular trend of the consumerization of technology, who knew more than Steve Jobs. And it's really impossible to overestimate the extent or the significance of this consumerization trend. When we look at IT spending by sector for last year, we can see that consumer IT is by far the biggest bar in that chart. Where's healthcare? bringing up the rear. To put this another way, when we think of all the giants of IT in the hospital, right? The Cerners, the Epics, oh, Epic, the amazing Harry Potter themed campus. These guys are gorillas. We can't mess with these guys. Well, you know the thing is, consumers spend more money on AirPods than healthcare spends on EHR. You wonder why the EHR isn't what you want it to be? Underinvestment. Underinvestment. Yeah, consumers spend more money on AirPods than healthcare spends on electronic health records. And if you threw in the Apple Watch, consumers spend more money, Apple gains more money, makes more revenue on that than healthcare spends on all of its IT. Admin, accounting, every computerized anything in the hospital is a drop in the bucket in the information technology world. So what does this mean, this trend of consumerization? Another favorite quote, and I think it's important to remind people, especially people who live in healthcare, that folks don't primarily want good healthcare any more than they want a good mechanic. Right? What people want is good health, however they get it. Now, you might have looked at this graph and you thought, okay, AirPods, that's an interesting factoid, but what does it actually mean? It's a completely different industry. It's got nothing to do with healthcare. Well, let me explain. IT spending matters because IT spending means innovation, and innovation gives us new capabilities. And for decades now, consumers have been gaining capabilities at a much, much faster rate than healthcare because the technology is aimed at them. The data transfer in healthcare, and I hate to bring up this example, but here we are, is still often done by fax. I work with one of our audience members, Maria Marquez, at a place called Mary Center, a fantastic place. I love it to death. But I'm sitting at my desk is next to a copy machine that I guess uses the dial-up internet, and I hear that tone all day long. No, all day long in 2023. The fact that I can book an online appointment for my barber, right, who works at a place with like 5 people working there, but not for my doctor. The fact that I can search all the news articles on a particular topic for the last 20 years in a fraction of a second with Google, but I can't do a text search in my EHR. These confirm this graph, and they tell us where the innovation money has been going. And one of the capabilities that we gain, that consumers gain from all this IT spending, is the ability to diagnose and treat ourselves for things that used to be the realm of healthcare. Wait, what? I'll give you an example. Here we can see a simple graph with capabilities along the x-axis and cost along the y-axis, looking at doctors versus regular folks. Now let's imagine it's April of 2020, and you wake up in Washington, D.C., you're the average Joe or the average Jane, you wake up with itchy eyes and a stuffy nose. In order to get treated for what is almost certainly seasonal allergies, hay fever, you would need to do what? You would need to call and speak to a scheduler on the phone, probably wait on hold. You'd need to take off from work and show up at a front desk at the appointed time. You would need to get taken back to a room by a nurse, speak to a doctor, get a piece of paper from the doctor, bring it to a pharmacist in another location, and all of that would be to treat your allergies. You might even need to speak or make another appointment with an expensive specialist. But something else was going on back in 2000. Within about 5 years of that year, all of this stuff happened. All these amazing information tools, many of them specifically focused on providing not only doctors, not only healthcare professionals, but also consumers with health information. So what happened when consumers and doctors both got access to all those great information tools, including the specifically health-related ones? Well, we all gained more capabilities, didn't we? According to medical science and the FDA, we also gained the sudden ability to diagnose and treat our own seasonal allergies, as Claritin was made over the counter. And that little bit of healthcare that I've just described, with its little bit of employment and its little bit of revenue, just wasn't healthcare anymore. And it wasn't just seasonal allergies. Over the last 20 years, many, many drugs have been made over the counter. Drugs for yeast infections, drugs for acid reflux, Advil. Yes, you used to need a doctor's prescription. You'd have to make an appointment to get Advil for your headache. And just as we saw with the subway, the same technology in this case both makes the incumbents, the doctors, better, but it also makes the challengers, in this case the consumers, better. So the reason that consumerization of healthcare matters, the consumerization of tech matters for healthcare, is that some of these new consumer capabilities result in a hit to healthcare. It's kind of the death of a thousand cuts. But at the same time, they expand the scale of health, right? In this particular case, allowing many, many more people to get relief from seasonal allergies. Cheaper, faster, and easier. Definitely what Clayton Christensen, I think, would recognize as disruptive innovation. In this case, with the disruptive technology being the internet and Google and I guess the computing in general. And sure, it's better. It's definitely better if you can see an allergist about your allergies, right? I mean, if everybody on Earth could see an allergist and consult with an allergist about their seasonal allergies, that's better. But Dr. Google is cheaper, and it's faster, and it's easier, and it's good enough for most people with hay fever, and it's available in your pocket 24/7. All right, so if you're a skeptical audience of healthcare professionals, and there's a lunatic standing in front of you on a stage telling you that consumer technology is hitting healthcare and boosting the scale, you'll need to see some evidence, right? Let's see what we can talk about. Now, regarding the boost to the scale of things like Claritin, or Advil for that matter, there's no question at all that once Claritin went over the counter, sales went way up. Drug companies love the idea of eliminating the middleman, in this case, healthcare. Over-the-counter drugs in the United States have skyrocketed over the course of the last decades. How about the evidence for the hit? Exhibit A. There are currently about 700 over-the-counter medicines that used to require a prescription. About 10 years ago, Booz & Company created a report looking at the effect of this on healthcare, and they said, if we didn't have these over-the-counter medicines, we would need about 60,000 more medical practitioners. 60,000. That is about 6% of practicing doctors in the United States. That's not a small number, people. And that's not even talking about all the support staff that aren't needed for those appointments that aren't happening. The clerks, the nurses, the parking attendants, right? The security people. And note that statins and birth control pills, among the most commonly prescribed medications, are on the table at the FDA to be made over-the-counter in the near future. So what is the next edition of this Booz report going to look like, I wonder? Exhibit B. This is a study that was published in 2020 out of Harvard looking at millions of primary care visits for insured adults, which found an overall 24% decline in the period from 2008 to 2016. Now, I know there's some primary care people in the audience. This is not a small number either. A 24% decline? Researchers in the paper didn't know exactly what had caused the decline. They thought part of it may be from going to things like urgent care, et cetera. But they thought about 75%, the majority of the decline, could be related to increasing use of online self-care or searching the internet. Exhibit C. Now, we've heard our whole lives and our whole professional lives about the skyrocketing healthcare costs in this country. And it's certainly true that healthcare costs have been going up for decades. This graph shows per capita costs in the United States over about 60 years. But it's also true that the skyrocket is slowing down dramatically, as we can tell from this graph, which shows the first derivative of the upper graph. That is to say, the rate of change of healthcare costs from decade to decade. And that has been consistently going down for decades. And at the current rate of decrease, right, so what we're talking about is that skyrocket is still going up, but it's almost reached zero velocity. And that means that at this current rate, we can expect that at some point in the next couple decades, the healthcare cost per capita will drop below zero, will start to decline. And don't think we're going to make it up in volume, not in a country where the population is barely growing and the life expectancy is dropping. But the funny thing is, when I ask people in all sorts of fields, including healthcare, why are healthcare costs decelerating? First of all, they didn't know that. They haven't heard of it. Second of all, they mention a bunch of things, when pressed, that are just too recent to explain this very, very long trend. And see, the one thing that they never, ever mention, at this point I think I've asked this question of hundreds of people, CEOs of health systems, they never mention that information technology revolution that we have all lived through, which is very strange because in our lifetimes, the primary reason for lowered costs for services across the board, no matter what the industry, is IT. Now, why doesn't anybody think this is happening in healthcare? It may have to do with that graph I showed you earlier, where healthcare is at the bottom. I mean, how could healthcare revenue, how could healthcare costs be going down if healthcare is so bad at technology? If healthcare is so, hardly using information technology? Well, it may be because if people outside of healthcare are using that technology to pull revenue out of healthcare. Remember, the taxi industry has not been losing revenue, has not been lowering costs, right? That's not been losing revenue for 20 years because the taxi industry is really good at technology. They're losing revenue because Uber and Lyft are really good at technology. So we have some strong evidence, and I'd say some suggestive evidence, that something is reducing the scope and the revenue of healthcare. Decreased primary care, all those redundant providers because of over-the-counter drugs. And it's funny, I've had so many people, when I talk about AI, ask me if I think AI is going to replace doctors. I have yet to have a person ask me if I thought over-the-counter drugs were going to replace doctors. But that is exactly what they do. And there's no indication that any of this stuff is slowing down or stopping. Another favorite quote. Now, we've gone over a whole range of topics. I just want to do a quick refresher. So far, I've tried to explain that, one, disruptive products are usually worse than the products that they disrupt, but better in one key way. Sometimes that's price, sometimes that's ease of use. The iPhone wasn't cheaper than the phones that it replaced. It wasn't cheaper than the BlackBerry. It was just easier. Two, that healthcare is basically in last place for IT spending and innovation. Three, that IT is enabling the public to do a lot of things for themselves, and this is across many different fields, but this is true in healthcare too. A lot of things people used to go to the doctor for, they don't have to go to the doctor for anymore. And this is already shrinking healthcare's role and healthcare's revenue. So what do the next 20 years of healthcare look like? 2 words: better and smaller. Now, when I was running through this talk and developing this talk, I ran this past some healthcare folks. And they really, I think the word, and I rarely use this word, the word is they bridled at the suggestion that healthcare was getting smaller. I found that interesting because I don't know how many of you subscribe to Becker's, Becker's Hospital Report, or that email thing you can get that talks about the healthcare industry. And I get an email every single day. I would say that if I counted up the number of hospital closings reported in Becker's, it's got to be at least 5 a week. Hundreds and hundreds of hospitals are closing in the United States. We tell ourselves it's rural hospitals, it's just urban hospitals. No, guys, it's hospitals. It's hospitals. Remember, this technology, all this consumer technology, is both supportive and sustaining to healthcare, and it's also disruptive. And all those technologies are going to help us get better. But when we talk about how we're going to get better, a lot of times people want to know how we're going to implement the latest AI. How's that going to do it, right? They don't want to talk about why the EHR rollout has not been, let's say, optimal, and how our continued use of the fax might impact our ability to successfully implement AI in the hospital, like those things have nothing to do with each other. I think the better is going to come out a little bit differently than using the AI and the latest technologies. So one of the most exciting, maybe even revolutionary technologies that hit healthcare over the pandemic, and that now is widely used and people think is fantastic, people are trying to do more of it. Of course, I'm talking about a little something called telemedicine, right? Everybody is very excited about telemedicine. We call it telemedicine. Everybody else calls it FaceTime, which we've been using to do personal video calls for 10, 12 years now. Welcome, healthcare, to the future. I was on a panel a couple of years ago, and I said, the next 20 years of healthcare tech is the last 20 years of consumer tech, right? Because, and I'm not kidding, this is going to dramatically, telemedicine is making healthcare better. These things are going to dramatically make healthcare better. How about texting, right? Texting. I text all the time. I text for all sorts of things. I text with my doctor. I text for all different kinds of things, but we put so many needless obstacles in the way of texting in the healthcare system. Guys, this is super useful. We will begin to use this more in healthcare because it's super useful. How about location-aware services? Have you ever stopped to think about the economic impact How much healthcare capacity is mismatched and time wasted because the patient was late or the doctor was late? And yet all of our patients and all of our doctors and every single person in this equation is carrying a GPS location tracker with them at all times. And these are used to great effect by lots of stuff that we use, right? Uber and Lyft and all this other software. So imagine it's 3:30 in the afternoon and Google Maps knows that that patient is 45 minutes away. And they are not going to make that 4 p.m. appointment. Google Maps knows, healthcare doesn't know. But we're gonna know, right? This stuff is beginning to be adopted. Oh my God, it seems like a miraculous, far-fetched dream that we could do something like this in healthcare, but the technology's old, folks. This technology's old. We wanna know how we're gonna implement AI, which, I mean, ChatGPT came out last November, and we still haven't implemented texting. We're still using fax, or the most obvious choice of all, which is convenient online scheduling. Yeah, we can book an appointment with a barber or a movie theater or a restaurant, but not yet with most healthcare systems, with most hospitals and most clinics. And you know, the last time I took my son to the pediatrician, they said, okay, his next appointment is in 6 months. And I said, oh, well, let's go ahead and make that appointment since you're sitting in front of your computerized scheduling system. And they said, oh, we can't make it that far in advance. We can only make it 2 months in advance. So you have to just remind yourself to call back within 2 months, not at 2 months, it's got to be a day less than 2 months. So make an appointment, make a reminder for yourself, which I did in my iPhone, to call back when it's slightly less than 2 months. Then you can wait on hold because you got to call back. You can't do it online, even though they have a new patient portal to replace their old patient portal, but no patient portal allows me to make the damn appointment. So I have to wait in line, wait on hold, finally reach the person, and then try and figure out when we can make that appointment. You know, I can, right now, make an appointment for a hotel room in Hong Kong on the other side of the planet for a year and a half from now, in 5 minutes using my phone. But I can't make my son's pediatrician appointment online or on a phone, or even at this moment using any technology, not even calling the office. Now, what about AI? As I've said, AI is the latest, surely not the last, IT innovation on the block. Well, first of all, we have to remember that AI is built into all of this stuff. Right? We use AI all the time, right? When you use FaceTime now, if you use FaceTime or similar services, Zoom, it centers your face in the picture, right? It's using AI with the camera to figure out which part of the picture is your face, and it moves it. It's fantastic. You know, I used to call my mom on FaceTime. I gave her an iPad for this purpose, and every time I did it, I was looking at her ceiling or looking at her lap. I got the latest iPad that has this technology built into it, and now every time I'm looking at my mom's face and it's perfectly illuminated. It's fantastic. All the software that picks the best route when you're trying to get, for example, from my clinic today to get over here, all this stuff uses AI. Did you guys know that on your smartphone, you probably know this at this point, a couple years ago people didn't. You can go into the Photos app and you can type the word dog and it'll show you all the photos with a dog in it, but you didn't have to tell it what a dog looked like. You can even type collie dog or German shepherd or whatever the dogs are people have now, but they all end in poo. You can type that in and it will only show you pictures that have those things. That's AI built into all the stuff that we do right now, seamlessly a part of our lives. But AI, of course, can be more than this, as we are discovering. And I found that this book, which came out in 2018, and these specific authors have a new book that just came out, a little bit more advanced. They're economists for the most part. But I thought this was useful in understanding the implications of AI. So Agrawal and his co-authors talk about the 50-year revolution in computing that I've been talking about as a revolution in cheap math, right? The ability to take everything that, that someone was used to be doing with a desktop, one of those desktop mechanical adding machines, and that becomes just a cell in a spreadsheet, right? All that stuff gets completely automated. And if you think about the usefulness of Microsoft Excel across every industry and every domain, even personally, you can see what they're talking about. But they characterize AI as something different. This is a revolution in cheap prediction. Now by this they mean, of course, for example, a system that might look at an X-ray and tell us that there's a 95% probability that the X-ray represents pneumonia. But to me, a better sort of natural language way to describe what that is expertise. Because isn't that what a doctor reading that x-ray provides to us, right? By telling us it's likely to be pneumonia, that's the doctor's expertise. We are automating expertise. So let's look at some examples. And a lot of this stuff is even pre-ChatGPT, right? That's just the latest thing. Wobot is a chatbot. How many people have heard of this? Nobody. You have conversations with Wobot. It used to just be, I think, on Facebook messaging, but now you can do it on a lot of different platforms. And Wobot is designed to administer something called cognitive behavioral therapy, right? CBT. This is a very effective treatment for depression, I'm sure as people know, among other things. And until recently, this could only be administered by a human therapist. Now, it's early days, but initial results seem to show that CBT from a chatbot is as effective as CBT from a human. And Wobots is in our pockets 24/7 and can do millions of these CBT sessions simultaneously, and here's the kicker, at almost zero marginal cost, which is to say, once the system is set up, the additional cost of having an extra 1,000 simultaneous sessions or million simultaneous sessions drops down to pennies. This is the domain of healthcare, or was until recently, with the economics of Gmail. Remember, you used to pay for email. There's people in this room that used to pay AOL for email. Remember that? IDXDR is an AI system that takes pictures of your retinas and then tells you if you have diabetic retinopathy. Obviously, this is a very serious and common problem. This was the first machine authorized by the FDA back in 2018 to make a diagnosis without any involvement of a physician at all. And it wasn't just any physician who was making that diagnosis before IDX came aboard. It was a highly trained ophthalmologist, right? One of the most highly trained, highly skilled, highly paid elements of the healthcare system. Now, of course, this is very useful to have a machine being able to do this because we have 37 million diabetics in the United States and only 20,000 eye doctors. And there's a recommended annual evaluation, but that would require all of those 20,000 eye doctors to see 7 diabetics for this purpose every single working day of their careers. And that is not lucrative, and that is not happening. And I'm not even talking about the rest of the planet who do not get to see eye doctors or doctors. It's easy to imagine, since there's no technological reason that this can't just be done, like you don't need a tech to do it, you don't need a doctor to do it. Easy to see that this might be right next to the blood pressure cuff in the drugstore. And actually, since it seems increasingly likely that retinal scans, we are now learning because of the implementation of AI, will provide better measures of cardiac risk than blood pressure, it may just wind up replacing that blood pressure cuff. It's incredible. You know, we've had ophthalmologists looking at retinal scans for decades and decades. We didn't know until we started implementing AI looking at those same retinal scans that you can determine, and we don't know how, gender, race, blood pressure, cardiac risk, all these different things coming from a picture of your retina. All the stuff we had no idea was in that image before. This example is one of my favorites. ResApp is an app that was created by Australian docs and research physicians. And it was approved, it's been approved so far by the European version of the FDA, but not by our FDA yet. This listens to your cough, and it tells you if you have pneumonia. And they're marketing it to healthcare professionals, which is nice, but they're also marketing it directly to consumers. And this is the kicker, they were just acquired by Pfizer, who, as I mentioned, has a big interest in being able to bypass the healthcare system and sell drugs directly to consumers. Interestingly, a lot of the discussion, a lot of the AI that was first implemented starting about a decade ago centered around image recognition. And so a lot of the stuff that's been discussed in healthcare AI is about image recognition, particularly in radiology. These predictions of the doom of radiologists, for example. Whether machines that are reading x-rays will replace radiologists reading x-rays. And here we can see an internist who's ordering an x-ray and a radiologist reading that x-ray. So maybe that gets replaced by a robot or an automated system that reads the x-ray. Now this, of course, is probably more important to the radiologist than it is to the internist, because the internist doesn't really care who reads the x-ray. As long as you get an accurate reading, right? I don't care if it's a radiologist or a machine or my iPhone. And from the system perspective, from the hospital's perspective, it's probably a lot cheaper than radiologists. But technology like ResApp raises the question of whether the patient with the cough and the fever ever gets to the internist in the first place. or if that chest x-ray, and this is really important considering the effects of radiation, or if the chest x-ray is ever even needed. Because apparently we just found another way to make that diagnosis that is both cheaper and easier and doesn't involve radiation at all. And if the app says no pneumonia, the consumer saves a trip to the internist and the doc loses that visit. And if it's positive, I guess they go to the doctor, or maybe the app just prescribes the antibiotic. You think that's far off? Back in 2019, the FDA announced that it was doing studies and having discussions about having apps being able to prescribe medications, specifically for chronic illnesses, because they felt that people with chronic illnesses had a lot of obstacles to getting to see doctors and getting their refills and et cetera, et cetera. And this just came out last year. This is not machines replacing doctors. This is having chemists or pharmacists prescribing medications. This is, as you can imagine, causing an uproar among doctors in the United Kingdom. And of course, if we're talking about AI, we can't stop talking about the latest things like ChatGPT, or probably the best known medical version, which is Google's system they just came up with called MedPalm 2, which can apparently now perform better than humans on medical licensing exams. So we better get used to headlines like this. The kid in this article, he had tethered cord syndrome, I believe. His mom had taken him to, it was something ridiculous, like 17 doctors over the space of 3 years, and no one was able to correctly diagnose it. And then she typed his symptoms into ChatGPT, and apparently the first thing on the top of the list. And ChatGPT is not a medical system. It's not designed to give medical opinions. It's not honed or trained to give medical opinions, but apparently it gave this mom what she needed. And this has caused Dr. Scott Gottlieb, who you guys probably became familiar with, if not for his work at the FDA, but for his work during the pandemic, to say that he thinks it's not if, but when we have AI doctors stepping into the role of physicians. So we have to ask ourselves what happens when our already Google-equipped consumers and doctors get a hold of AI like what I've discussed. Well, we get even smarter, right? We get even more capable. And obviously, this is going to just work for pneumonia as for ResApp, but with lots and lots of other things. And of course, this is how we get to the smaller. Let's bring it back to the beginning. So, I want to tell you a story, and you can stop me if you've heard it before. For more than 100 years, health services have been produced in integrated mills, as shown on the left. Starting in the 1970s, mini mills, as shown on the right, began to be created, and while the integrated mills could do any kind of health service, produce any kind of healthcare product, the mini mills were limited to a small subset of that. But their advantage, as you may know, is that they could provide those services more cheaply. But it turns out there's another kind of health service producer, and that's the one I've been talking about, which is consumers, the public. And while most of the public, of course, cannot yet approach the capabilities of the integrated mills or even the mini mills, they do have the advantage of being a lot cheaper. And this is important to think on. As more and more health-related services become digital products, like Wobot, right? We are in the process of, even with our missteps with EHRs, we're in the process of digitizing our health system, digitizing health data. As more of those things become digital, become ones and zeros, the marginal cost, as I mentioned before, of applying them to more and more and more people becomes less and less and starts to approach zero, something that we just don't see when interactions involve humans, right? An actual human provider. We're increasingly going to see things that we currently pay for in healthcare become free with our Prime membership or our Costco membership. Or, in fact, I think Costco just mentioned that they're going to have some clinical stuff. I think it's mostly telemedicine. Or ad-supported and provided by Google, just like Gmail and all those other things that we love Google to provide for free, and all they get in exchange is our eyeballs looking at ads. Or maybe it'll just be a built-in feature of our smartphone. You know, I bought my mom a smartphone a couple years ago because it had fall detection. My mom's 82. And at some point, they implemented gait detection, right? So now it not only will tell me after the fact if my mom fell, but possibly more usefully, and maybe this may affect the income of orthopedic surgeons. Now it tells my mom when her gait is becoming more unsteady and recommends exercises she can do to remedy that unsteadiness. From you've got mail to you've got pneumonia. And as more and more health expertise is digitized, it's going to move more and more into retail clinics and more straight to consumers. There's going to be many things that we think of now as healthcare that we won't in the future think of as healthcare, like getting a hold of Advil, which used to be healthcare. And healthcare may be whittled down to those things that are hardest to automate, the hardest to reduce to just information, like maybe surgery, I'm not sure. And things requiring equipment that maybe is too complex or too expensive for people to have at home or to afford. So what does this mean for all of us who work in healthcare? I think this is particularly going to be interesting to the residents tomorrow. It sounds like a lot of change over the next couple of decades in healthcare, and change is often frightening. Still, frightened or not, I think that forewarned is forearmed. If you're a physician and your main product is expertise, you will find that some of your expertise will become automated and will be distributed by someone else. And that someone else may be unsurprising, like a PA, or it may be completely unexpected, like TikTok. And you will need to think hard about what you can provide that the technology can't provide. Many physicians will leave the profession, but I read recently that about 20% of physicians, 1/5 of physicians, are already considering leaving practice in the next 2 years. If you're a surgeon, it seems likely, but I would say this is absolutely not certain, that surgery is harder to automate and you may have a little more time to think about this stuff. If you're a health system, you may find that you're losing knowledge-based visits, right? You're losing those visits that just convey expertise, because we have found better ways to convey all sorts of information, including that expertise. And you have to regroup at the health system and focus entirely on things that are tough to automate: procedures, surgery, emergency department, including some things that you're not doing now, right? I mean, it's always been amazing to me that there's so little interaction between the fitness industry and the healthcare industry. But the fitness industry, for the most part still, is something that has to be done in person. If you own a practice, you'll also be losing those knowledge-based visits, but you're also likely going to be able to rely even more on less expensive ancillary providers than you do now, because those ancillary providers and everyone else, including the consumer, will be upskilled. You could also, and I like this option, on an individual or on an organizational level, choose to become part of this change, to become one of the people that makes this stuff happen. There is right now an enormous need for medical and healthcare expertise in the tech industry, as tech giants like Amazon and lots of small startups too try to put Christensen's ideas into action. And one more note about Christensen. Every CEO in IT, every CEO knows that book and has at least read the Wikipedia summary. It is the game plan. It is the game plan for how to apply technology to new industries and take away their revenue. And I suggest that folks read it too. I think the trick, if you want to work within this field, and this applies more to, I think, to institutional partners maybe than individuals, is to be able to not give away the farm. Tech companies are generally going to have a much better idea of the value of the data that we have in the healthcare system than the healthcare system does. They will try to take it away at a low cost. And I think one of the things that healthcare systems have to realize, and realize quickly, is that we have a valuable resource that they want. And in fact, it may be the only valuable resource that healthcare wants from us. You know, they need expertise, but they can hire us to give expertise, but not all of us. But they also need our data to be able to develop new AI tools that apply to things that happen in the hospital. And you know, if we just do research partnerships and they give us like a nice new building or an MRI machine, you know that they are giving us way less than they are getting. Now, last year, the folks at Andreessen Horowitz, this is a venture capital firm that was founded by Mark Andreessen, the guy that invented the web browser, who's now a billionaire venture capitalist, they made this statement. They went on and said, start by imagining that United Health Group and Apple had a baby, and that baby had the business model of United Health, but the sleek consumer experience and the brand loyalty of Apple. We think this will be the biggest company in the world. We think this company will be built, and we can't wait to work with them. And I don't doubt for a minute that members of the audience, and members of the audience tomorrow when I speak to the residents, can be part of that adventure. Now, we covered a lot of ground in a very short period of time. I appreciate the near dead silence of the audience, which I'm going to interpret as attention. And I expect and I look forward to thoughtful questions and gently worded critiques. Thank you very much. And I think they're going to coordinate the microphones and questions. Hi.
I'm Sally Conrad, and I work in IS here at VHC Health. And this has been quite enlightening. And in part, I think that, is this better? Can you hear me?
Yeah.
I just have a few comments and have a little bit of a commercial for our own VHC patient portal. So while you were talking and the scenario where patient father couldn't schedule patient's son's appointment, I just checked my portal, and thanks to our providers, we allow our patients to schedule up to, I think mine said August of next year.
Mm-hmm.
So cool for us on that.
Fantastic.
On top of that, we also have a geolocation in our house. We have wayfinding. We have directions to the parking garage of the building where your appointment's at. So I have a feeling that there's a lot more technologies we can add to our patient portal.
Right.
But what I'm finding is that companies like Epic are trying to stop
Stop that. Yes.
innovating. Yeah, I just had a conversation with Epic, and some of the things that I'm offering on my portal, they're now going to start charging me because I'm offering it in a way that they are not. So any comments on organizations like Epic
Mm-hmm.
that are just trying to, I don't know, put guardrails around innovation?
Yeah. So I have a lot of comments about Epic, but I'm not sure if there are any kids in the audience, so I got to think carefully before I choose this. So I think Epic, does what businesses do, which is they do what's best for the business, and that hasn't always been the best thing, I think, for our business. So I think everybody has a general sense that, again, EHRs have not been what we were promised, have not worked out well. We're trying to correct that in different ways. But honestly, I think that the solution to this is going to be as we drag interoperability, as we drag it out of them, as we're currently doing. On my phone, during the pandemic, I got vaccinated. And I remember I was at Georgetown, which is one of the places where I work, and I got vaccinated. And the nurse asked me if she could update my paper. That's right, it was 2022 or 2021, my paper vaccination card in the United States of America in 2021. And I said, oh, that's okay. As soon as you enter in the system, it's going to send me a notification on my phone, and it'll be inside the health app on my phone. I said, oh, I didn't know that. I mean, this stuff is here, right? A lot of this stuff is here. I have all the clinician, happily, I don't have to go to the doctor very often, but all the clinician notes get automatically posted to the app on my phone, right? So we have that ability. What we don't have right now is the ability to write into the system, right? Now imagine, right, and trust me, whatever I'm saying right now, the people at Apple thought of 10 years ago, right? Because they're the ones who are making a lot of this stuff happen. And they don't want to. I remember at some point somebody said, "Oh, do you think Apple will buy Epic?" It's like, did you see that AirPod slide? Apple doesn't want Epic. They spend more on donuts than Epic makes in a year, right? What Apple wants is to create a system that enables lots of independent developers, as they have with everything else on the iPhone. They want to create a system that allows independent developers to create things that are useful and sell them to people. And I think once we have, already with the ability to pull the stuff out of our different health records in multiple different systems, tremendously useful, but it's just the beginning. How many people here have heard of a financial product called Personal Capital? Anybody? A couple people, right? I think now it's called Empower. It was bought by somebody else. Basically, it's called an aggregator. What it does is you create an account at Personal Capital. I have no relation with the company, and except as a user, and you basically tell it your different bank accounts and retirement accounts, et cetera, and it gives you something that I personally had never had before about 5 years ago when I signed up for this, which is a unified, overarching view of my entire financial position. My net worth over time, the overall fees I was paying for each of the different investments, all this kind of stuff. And the first thing I thought was, wow, and the second thing I thought was, how come I can't have this for healthcare? I mean, my healthcare situation, again, thankfully, is very simple. My mom's is very, very complicated. She doesn't have any, like, her physicians don't know what's going, each one doesn't know, one hand doesn't know what the other one is doing. She doesn't have an overall picture of this kind of stuff. Medical, medicine reconciliation across the board. But the fact is the pieces are in place for us to have a personal capital for healthcare. Now, personal capital won't let me do transactions. I can't move stuff around in the accounts. I can just see the accounts. But that's coming. The only obstacle right now for us to be able to write into those records is basically that each hospital system is trying to figure out, is this good for us or is this bad for us? And Epic and Cerner and all the rest are trying to figure out, how can we stop this? Right? So once we have that, and you have individual companies being able to, sort of say, look, I know you guys use Epic, that's totally fine. But if you happen to want to, we've got a free app that's, ad supported or whatever, like that we found some way to make it really inexpensive, that you as a doc, you can actually access all your patient records from Epic, but actually this is way better looking than Epic, and it tells you stuff, and it shows relationships, and basically this becomes your EHR. And yeah, Epic is still the engine that's collecting the data in the hospital, but you basically have a different window into that same data, right? That's what personal capital and things like it have done, and they've begun to be adopted by, for example, if you have a retirement account, you can probably do this within your retirement account, the same kind of aggregation. I think that's going to be the salvation for a lot of stuff we do with healthcare, but the context, remember, is that people are also trying to eat into our revenue streams. Can I talk to you about it afterwards? Because I do want to give other folks a chance. It's not because you're talking too much, it's because I'm talking too much. Yeah. And by the way, I'm going to stay as long as it takes.
A very provocative talk. There was something that you haven't touched upon, which is particularly an issue with the large language models like ChatGPT, and that is what is referred to as hallucination.
Sure.
The example perhaps of the tethered cord syndrome. These programs have no sense of certainty.
Sure.
And in particular, something which we learn from experience is in other words, we're responsible for an estimate of that probability.
Mm-hmm. Yeah, I totally agree, but keep in mind, I don't know whether large language models, whether ChatGPT is ever going to get more certain or more useful, or if it's just going to not pan out, right? That happens in tech, right? They come up with something, and I mean, I think this thing called crypto was a really big thing apparently like 5 years ago, and now nobody talks about it. Now they talk about ChatGPT, right? That could happen. I don't think it's going to happen, but it might. But the examples that I gave, other than the one specifically about MedPalm, which is Google's large language model for medicine, those way predate the large language models. They don't hallucinate. IDXDR doesn't hallucinate. It just reads retinal films better, faster, and cheaper than ophthalmologists, right? So we don't have to anticipate. First of all, to make healthcare better, we don't even have to talk about AI. We can just talk about texting and video calls, right? And online scheduling, right? And location service, like just those things. Imagine for a second a healthcare system that does that stuff. Imagine a healthcare system that the patients love, that they don't feel like it's wasting their time, that the providers don't feel like it's wasting their time or pushing them too hard, right? None of that stuff requires the problems, the very real problems that you highlight with large language models. I'm hoping that those things work out and they turn into useful tools. But I think one of the real key points to remember is we have failed in healthcare because of that first graph I showed you where healthcare is that tiny little bar. We have failed to invest correctly into the thing, information technology, that has made so many other industries more productive and more effective and beloved even of their users. We have failed to do even that, much less these latest kids on the block.
So I would be interested in hearing what you think of, all the data that's being collected by individual consumers
Mhm.
on their watches, their Apple Watch, you get your heart rate, you get all kinds of stuff. Like, how can physicians or healthcare providers in general harness all this information that each individual is collecting that may, predict health, so on?
Well, I think the first step is asking that question. Because to be honest, most of the physicians that I see asked by a patient if they can bring in their information from their Apple Watch or whatever, they get brushed off. Dr. Google, right? It's not Dr. Google, but the same kind of thing, right? Most docs that I've seen, and that's probably not a representative sample, are not particularly interested. And that may simply be because the system's not designed to let them access that. I mean, one thing I'll tell you is, for most people, if you told me, let's say the huge majority of Americans, if you said, look, doc, I want you to try and predict the course of health for this person and estimate their current health status. And you can have one of two things. You can have all the information about them and all the EHRs that they've interacted with, or you can just have their iPhone data. Actually, maybe you can just have their iPhone data from the accelerometer in their iPhone that tells me how much, how often, how fast, and how far they move every day. Which of those is going to be more useful for you in determining that person's health? And for me, it's the latter. There's no question about it. This is another problem for us too, because as I said, the data that we have in healthcare is very valuable, but it's very flawed. I estimate that probably at least 95% of health-related data is not in the healthcare system at all. Right? And that shouldn't be surprising to us because 95% of our health has nothing to do with the 5 minutes or the 15 minutes or the 30 minutes we spend talking to doctors every year. Right? It's what do we buy at the supermarket, which our phone knows because it's on our credit card bill. Right? I mean, imagine if you could take the information about what you buy every single week at the supermarket and your weight loss app tells you, hey, I've got to break this to you, but this does not match up with the goals that you are setting here in the weight loss app, right? So first of all, most of the valuable information is not there. But again, there is hugely valuable information nonetheless within the healthcare system. You got to keep in mind it's very flawed. I hand it to the EHRs for finally digitizing us. That's great. Nobody, I think, says it would be better if we went back to paper. But it's kind of like if you have the world's worst word processor and they're saying, do you want to go back to using a typewriter? You're like, no, but it's still the world's worst word processor. What I find in healthcare is that there's so much copy and paste that I'm just like, what percentage of the data that we have in our EHRs is actually real data or valuable data? Right? What percentage of it is actually going to enable us to do that? And that's why I think a lot of the stuff that we're going to really make use of, the examples I gave weren't so much about the diagnosis, really about administering our administrative process, right? Making that better. Because that stuff is real. We have real data about that stuff. We have real data about how long patients wait. We have real data about billing. And we have a lifetime's worth of work in just taking that stuff and using AI or other tools to identify what we can do with that. I think, not surprisingly, it is not going to be the healthcare system that first identifies what to do about our Apple Watch data. I mean, again, you look at that graph, right? Apple has the largest physiology lab in the world, right? They're spending not a little bit more than healthcare is. They're spending orders of magnitude more than healthcare on information technology, and they're one of the best companies in the world at it. Their CEO says he thinks that the most important thing Apple's going to do, the most impact it's going to have, is in health. This is like if the CEO of Uber in 2012, a couple years after they came out, was going to taxi executive conferences and saying, what we really want to do, the impact we want to have is on the taxi industry and taking people around. And the taxi industry people are not paying any attention. They're telling us what they want to do. And they will use that data. They will use that data, hopefully, to not just make money, but to make us healthier.
Is that possible with Medicare and Medicaid?
Well, Medicare and Medicaid doesn't pay for my Apple Watch. Right? But the price of those Apple Watches just keeps dropping. Right? Not the top-end model, the bottom-end model, which is way better than the top-end model from 5 years before, right? I'll just say. This man has been so patient.
Bob Woolman here. Thank
Pleasure.
you very much, Dr. Selanikio. Fascinating. And I really like the emphasis on all of the technology, obviously, which is the subject. In Washington, D.C., where I worked in healthcare, about 100% of the residents have cell phones if they are distributed free to those who need them. But about 12 years ago, when this was last looked at, the rate of functional illiteracy in Washington was, as defined as an inability to read a bus schedule, was 38%. As practices...
What's the bus schedule?
As I can see where practices are going to streamline such that they may eliminate telephone entry into the system and rely simply on a portal, how do we design a system that we don't trap those that are challenged or vulnerable from entering the system or benefiting from the trend developments that you discussed?
Sure. Well, first of all, I have to say right out that I'm not a big believer in the narrative about the digital divide, which is kind of what we're talking about here. And the reason is because I spent, I don't know, maybe 2 decades working for CDC in poor countries. And one of the reasons why I give talks like this now is because I was privileged to be able to actually watch the rollout of phones and then smartphones in poor countries. Talking to people about, I remember at one point, and people in the audience may remember Palm Pilots, talking to people about Palm Pilots. I used to work with Dr. Mark Grabowski on these kind of projects. And then at a certain point, I realized that the people in the audience actually had phones and didn't need to be lectured about Palm Pilots. I think it is damn near impossible to find in, let's say, rural Ghana, a family that does not have an Android phone, at least for the family, right? I would say it is impossible to find a village that doesn't have one, that everyone has access to. We had decades and decades of World Bank funding for all sorts of digital this and digital that. And you know what got cell phones in the hands of 7 billion people of the Earth's population? The market, right? I mean, yeah, there's a digital divide in the fact that I've got a really recent iPhone, and my taxi driver last time I was in Nairobi just had a used iPhone that was like 5 years old. To me, that is an imperceptible divide. All the basic functionality. I mean, he doesn't have gait detection on his iPhone, and I'm sorry about that. But he's got everything else there. I really feel like this is a problem. I mean, that is. So I work at Mary Center with Dr. Marquez here. A lot of the patients are poor, working class. You think any of them don't have a cell phone? I mean, we mentioned like we have a program to buy cell phones for the. You said buy cell phones for the residents that don't have them.
I mean,
who are these residents?
Well, everybody has at least one cell phone.
Of course. Yeah, one smartphone, one supercomputer in their pocket, connected to a worldwide network with all of at least the written information and a lot of the video information ever created in their pocket all the time. Like they all have that in their pocket. And so and the fact is that my patients at the clinic have that same thing too. So, again, I'm skeptical of the narrative that we need to, for example, set up a government program to make sure that everybody gets access to technology. It's like, let's set up a government program to make water flow downhill. It's already happening, right? It's already happening. I mean, you can't pick a worse example, I think, of technology failing to roll out than the success of the mobile phone, right? We can talk about it also afterwards.
There's a significant amount in the patient population of anxiety and neurosis.
More and more, I've heard.
Is AI going to be able to handle that without the human touch?
So that's a fascinating topic. I showed you that thing about Wobot, right? That chatbot that goes back and forth. And it's really interesting because you think how do people feel about that? They know it's just a program, right? What they found, and again, it's still pretty early days, but what they found is that people, when the company that makes it, which is headed up by a couple of psychiatrists, when they asked people, do you like Wobot? Do you think that Wobot cares about you? Like the majority of the users said, yeah, I think it cares about you. It cares about me. I really like Wobot. I think Wobot likes me. They know intellectually that it is a machine. You know, Dr. Eric Topol, right? Very sure everybody's heard of Dr. Eric Topol, editor, you know, head of Scripps Institute, editor of Medscape, et cetera, et cetera. About 5 years ago, Dr. Eric Topol came out with a book. I can't remember which of the many books he's written about technology and healthcare, all of which I've read. And in the book, he said, you know, the one thing that they're not going to be able to automate is the human touch, is empathy. So last year, I think it was last year, or maybe early this year, Dr. Eric Topol came out with another statement in which he said, and he was talking about things like with ChatGPT, one of the main uses for AI may be that we can use it to help teach doctors to be more empathetic. Over the space of 5 years, Dr. Eric Topol, who knows a lot about healthcare and technology, apparently went completely 180 from, we'll never be able to automate empathy, to maybe we can use this automated empathy to teach doctors how to be more empathetic. You know, I mean, I'm a doctor. I want to be empathetic with my patients. I think I'm empathetic to my patients. But the experience that a lot of patients have of their doctors is not one of empathy. We may be thinking about nurses, right? They find their nurses are empathetic, but they generally often don't find. I mean, it's not hard to find these complaints. So one, again, I think that we've got a little work to do on our empathy. But two, it seems, you know, I'm just going to take Dr. Topol at his word and say, yeah, it does seem like it's possible that we may have machines that, and it's hard for me to wrap my head around this, appear to be more empathetic to the patients than we are. And you know, I've seen examples of this, and the Wobot is another powerful example. I don't really understand it. It does kind of break my head a little bit, but apparently, you know, I guess actually I was just reading that they have now, you know, they use ChatGPT type things for like fake automated girlfriends and boyfriends, right? People are dating, you know, AI. Again, I'll leave that for the next speaker, you know, to talk about. I don't know, but
to speak to that issue, I have seen many patients who have seen other doctors who come in and say, the doctor never looked at me,
right.
He never really talked to me, all he did was play with his computer.
Yeah.
And
All
as a matter
the
of
time.
fact, that talking to someone else in the audience, we both had hospital experiences, and the nursing staff and the doctors, the hospitalist doctors, never introduced themselves to begin with.
Yeah.
They came in and said, I'm your doctor, but never basically introduced themselves, and the nursing staff very often doesn't do that as well.
Yeah, I've encountered the same
Talking
thing.
about empathy,
Right.
and they were skilled in what they were doing, but they had no idea what they were, what their status was, and what the game plan was.
Yeah.
Very often, as you say, the empathy issue very often missing.
Yeah.
And will AI basically expand that lack of empathy, as you point out?
It's crazy but possible. Yeah. Again, I'm not allowed to ask you questions. It's killing me, but
Thank you very much for this very interesting, great presentation. So just out of curiosity, because in the U.S. is the U.S. and the lobby and the companies and the power of the different lobbies are one thing, but so is there any country in the world that actually has done this right, that actually does have an electronic medical record that speaks and interacts? I mean, is there anywhere where we can take as a model?
So it's a great question that I unfortunately do not have the expertise to answer. I'm not an expert at international EHRs. I mean, I hear great things about stuff in Europe, but I heard great things about the NHS in the UK right up until it started collapsing. Because apparently you can't give away that much free stuff. So I'm not sure. I mean, you know, I think our bar is pretty low at this point, right? People tell me, like I had a conversation today with another doc at the clinic, and who said, oh yeah, you know, I said that since I've been working at this one location, I thought the medical record system, which is, Maria, what's the? eClinical Works, right, ECW, eClinical Works. I thought it was better than the Cerner that I used at another clinic. And usually when I say this at this clinic, people laugh at me and say, better? And then this person said, oh, I've worked with Epic, and I think Epic is a lot better. And I say, you know, when everybody tells me, oh, I think Epic is the best one, or Epic is even better, I'm like, You mean compared to other EHRs, or you mean compared to the worst free app on your iPhone? Right, because it might be better than other EHRs, but I still haven't found an EHR that's as good as the worst free app on my iPhone, right? So again, we don't have to get that much better to be much better. And as I tried to point out, we don't have to adopt the latest cutting edge technologies either. We haven't adopted any of the last 15 years of technology. We're just getting started too. So, can someone choose a questioner? Oh, I'm just going to pick this very kind lady right here. Go ahead, I'll repeat your question so people can hear.
What about the use of blockchain for medical records?
Mm-hmm. So the question is about what about the use of blockchain for medical records? And this may be a little bit in the weeds for folks, but blockchain is basically a way of keeping a ledger of transactions, right? So those transactions might be medical encounters or they might be financial transactions. And the unique part about the blockchain thing is that basically everyone who participates can see every transaction. Now, obviously, there's issues there for healthcare, right? Because you want to have protections in place so people don't see health data. But aside from that, I think there's promise in that idea, right? The idea is everything is verifiable and replicatable. But again, in healthcare, we haven't really exhausted the possibilities of the database, right? I mean, it's not like we can say, the software that you use and you love, I don't know what that is. I don't know what you use to make travel bookings or the stuff that you use online. All that stuff uses just regular plain old databases, not even blockchain. And a lot of that software, you're like, wow, this makes it fun to book travel. Oh, I love using this software. Like, we have a lot of that stuff in our lives, which is kind of amazing. And again, that just uses plain old databases. So I can imagine that blockchains might improve it a little bit. But again, in healthcare, we're so far behind that I kind of a little bit balk at the, how do we adopt this latest technology? And I'm like, let's get rid of the fax machines. Let's get the texting. Let's do online booking. Let's do the simple things that have already been invented and are easy to implement. We don't have to invent anything new. And then we can talk about, moving into those. I mean, there's obviously tremendous promise in all these things. So I think what they're telling me is they're yanking me. I'm going to stick around, folks. I think we have a reception, actually. I'd be happy to talk to folks if you didn't manage to get your question answered. Thanks so much.
Before you get to go to the reception, you have to go through this ceremony that has been fostered on all of our...
I'm not a hugger.
On all our speakers. This is a memento created by the original chairman of the Dolan Committee. And it's for giving an excellent lecture with an awful picture. Thank you.
Thanks so much. Thank you.